Welcome to PDR Live. Please subscribe to our channel and hit the like button if you have not done so already. So, I know in the previous live streams, I discussed how UnitedHealthcare CEO Brian Thompson received complaints on his very own LinkedIn profile. So, this is going to be a very brief live stream. And I just wanted to show you a couple of examples of people who went on his account and complained about the practices of his company. Now, we're first going to take a look at the United Healthcare post um, informing people on LinkedIn, their followers, of the murder of their CEO, Brian Thompson. And then we're going to take a look at some of the posts on Brian Thompson's uh, LinkedIn account. So here's the first one. This is coming from the company itself, United Healthcare. They have 1 million followers right there. And this was the announcement here. Now, you noticed that on this announcement, uh, they have turned off the comments. Here, the comments have been turned off. And this might have been a repost because, well, I do know that I'm not sure if it's on this one, but on the Facebook account, I believe they received the majority of the reactions were the laughing emoji. So I don't know if this was a repost or what, but it was shared. I'm sorry, it received almost 24,000 reactions on this post. Among the 24,000 reactions, they received 464 laughing emoji. 85 people clapped. Wow. Wow. 23 people. I don't know what this means. I don't know if these people this is a good idea. Oh, this sounds like a good idea. Now, the hearts, I don't know. That could mean anything. That could mean that they care or they I don't even want to go there. And so we can't even get into the comments if any were made. Um, should we like? Should we celebrate? Should we? Oh, I see. So celebrate, support, um, love, insightful, funny. So I think maybe the most appropriate one would be, if you really cared about this guy, it would be support. The celebrate here is not a good thing. So the celebrate, yeah, 85 people celebrated. Wow, what a shame. So yeah, that's wow. Yeah, what a shame. Um, this is Brian Thompson's LinkedIn account, and it's that's the verified account. This is his account, and I just want to take you guys. Well, here's a little bit of his background. He said he was named chief executive officer for United Healthcare in April 2021. They employ 140,000 people across the U.S. and globally. They're ranked sixth in the Fortune 500. And then it gives you here a background. He worked in the Medicare and retirement uh, part of the company before he was named CEO in 2021. And then he had prior to that served as the chief executive officer of the Medicare and Retirement Organization. He joined United Health Group in 2004. Prior to joining United Health Group, he was a practicing CPA at PricewaterhouseCoopers Limited Liability Partners, serving as a manager in the Transaction Advisory Services Group of the audit practice. He's a graduate of the University of Iowa. So it gives you here his experience right there. He's from Minnesota. That's his education, and so forth. Okay. Now, Oh, I want to go back to this later. Now, the posts that I was referencing, yeah, so he had a almost just over 9,000 followers. And this is a list of his recent posts. So I want to take you there to his posts. And I remember I had mentioned, I think in the previous live stream or the last night's live stream, that he my critique of him in these posts is that I don't see any evidence that he responded to these people. you know, so I don't know if those of you who are following my our live streams here, I made that point, because Pierce Morgan was asking for, I think it was Brianna Joy Gray's, or where's your empathy? Do you have any empathy for that? Well, and my response to that is like, well, I don't think this guy showed any empathy. So why are you asking empathy from Brianna Joy Gray, Bernie Sanders' former press secretary in the 2020 campaign? Why are you asking for her empathy when he's not showing any empathy at all on his LinkedIn account? And this is what, so I want to take you to the horse's mouth. Okay, just the facts. This is what he posted a year ago. Okay, so we work every day to find ways to make healthcare more affordable, including reducing the cost of life-saving prescription drugs. I'm proud of the work Chief Affordability Officer Matthew Vesladale and his team are doing to reduce costs for members. So he is reacting or reposting that guy's post. He received 6 comments. Okay. He got 328 reactions. 30 people found it funny. Okay. So 30 people found it funny. This is last year, mind you. This is from Andrea Huspeni. No, she's founder and CEO of Bye Bye Dog Breath and This Dog's Life. Okay. So, I don't think she's a leftist. She goes, Brian Thompson, this seems like a laudable mission. Okay. But United Health Group is failing my mother by not providing her the basic care to get better and back her life. You continue to delay any decision making and authorizations, which is compromising her health even more. And if she doesn't get back to her baseline, United Health Group is partially responsible. She is ready to get better. But instead, you have her lying in a hospital bed. Those who can make decisions don't work on the weekends, making her recovery process even longer, as United Health is denying her to go to her in-network program facility, which has been approved by everyone else, team of doctors, the rehab center, etc. So can you specifically lay out how United Health Group is committed to a, quote, more sustainable healthcare system? Now, so the network would be so United Health Group, they use Medicare Advantage. And what that means is that when you enroll in Medicare Advantage, there's such a thing as in-network and out-of-network. And so once you enroll, and if you enroll with this insurance company, you can only you can't pick with whatever doctor you want to go to, or whatever hospital or whatever clinic. You have to pick among the facilities that are in their network, okay, in that health insurance program. So she's not even saying that this is out of net. It's in network. It's in their, like, that's they approve. Okay, so, all right, and I don't see any evidence here that he replied to her. Beatrice Shaw. This message is an example of hypocrisy at its finest. You are denying claims for people who need it. Nicholas Common. The only thing this company is good for is screwing their customers. Hi, Nicholas. Please join me in the group listed above that I created. And then this person says Jessica Green, and that's campaign director, Colorado Reproductive Health, medical death prevention call time manager. You're doing a great job cutting your costs. Not having a single anesthesiologist in network in the entire state of Montana is a great policy to save you money. Let me repeat this is what this person's claiming. Not having a single anesthesiologist. Okay, you know what that is? It's like you need anesthesia before you get an operation, like especially a hip replacement surgery, by the way, because it's very painful. This person saying they don't even have an anesthesiologist in network in the entire state of Montana. Okay. It's ridiculous, right? Now, did he respond? Okay. I don't see any responses from him. Okay. 2 years ago, he writes, making healthcare more affordable means more money in people's pockets. And that's more important than ever right now. Reducing drug prices and improving price transparency are two ways we are working to lower costs for UnitedHealthcare members. So, better reactions. 8 people found it funny. 620 likes, 31 applauses, 24 loved it. Jenny Lieben, chair of pathology at SUNY, okay, State University of New York, downstate and Maimonides Medical Center. So this is a professional. Okay, so they're not coming on here just to attack him because they're activists or they're leftist radicals. Okay. UnitedHealthcare terminated my 86-year-old mother's Medicare Advantage plan with no notice on July 31st, 2022. I learned of it when her pharmacy called me. So she claims that these people, they didn't even have the decency to call her and inform her, hey, your mother, we're terminating her, or to inform her mother, hey, we're terminating your Medicare Advantage. An 86-year-old. The best I could get by phone was re-enrollment to begin September 1st. Oh, you can re-enroll. Your company left a senior citizen uninsured for 1 month with no mail sent or even email notification. Do better. So, if this is true, this lady, this professional, she's being way too polite. Way too polite to them. They kicked her 86-year-old mom out of their Medicare Advantage plan that they're hailing. Okay. Did he respond to her? I don't think so. Okay. When you go to the Apple App Store and the creators of the app put up their information on the app, and then you can rate the app, and you, whether it's you like it or dislike it, and you can leave comments, feedback, right? And what do you see a lot of times when people give either high 5-star rating, they'll respond and say thank you for your input. And then when they get a very negative, like 1 star, and a very nasty, like, review, they'll respond to at least one of them or two and say, hey, thank you for, they'll say, hey, thank you for reaching out to us, and we're going to get back to you. So, nothing. I've had UHC for the last several years. I have stage 4 metastatic lung cancer. We've just left UHC because of all the denials for my meds. Every month, there is a different reason for the denial. As of today, we're well over our max out of pocket for the year with having spent well over $20,000. Since we are in our 60s, we don't have time to recoup that. Like Jenny Livian said, do better. Right. Okay. Um, oh, this person got a reply. They got one reply. Okay. they, they got an invitation to join that lady's group. I'm curious, Pat Sagar says. Okay. He's starting a retirement. Okay. Okay. Money in whose pockets? It seems members are not the primary recipients when the ratio of CEO to median employee paid is 30 to 1. Okay, well, I think this is more of like a left wing, to be honest. Like, this is talking about income inequality and stuff. So your wanted to improve price transparency began only after government regulations made it compulsory. And so this person, that could be like, because I'm trying to be fair. Okay, I'm just trying to point out the cases where people have had a bad experience. Okay, so it doesn't seem like this person personally had a bad experience with this company. So we're moving on because he doesn't say, "Hey, you did this to my family or did that." David, okay, you seriously think UnitedHealthcare is lowering drug prices? Does Optum spread price? They sure do, which is quite literally raising the cost of drugs. Thanks. This person likes it. They like the company, and then they get reliable transportation. Now, my dad, his insurance company, we get that too. It's pretty reliable. We get, but the problem with the transportation though is that they'll send you places very far. So, like my dad, sometimes when he has to go in network to go to an appointment, sometimes the appointments are like, it's a 30-minute drive, right? And he can't drive, so the insurance company provides the transportation. I have a suspicion that, of course, they bill it to the government. Okay, so you can. That's my. I mean, I don't have the proof, but this thing that she's pointing out, I think they just bill the government for that transportation. Okay, so yeah. So this person loves it, never being denied for anything, and customer service. So this could be she's maybe one of the 66%, one of the 2/3 of the people who are not denied. So she likes the services, and she's a CEO of Rojas business, Glenny Rojas. Contact me for medical billing solutions. They are denials related queries. Okay. Nice work, BT. So he's tell Brian Thompson he's doing good. She likes what he had to say. And so, and well said Ginger Becker. Okay. And this is a picture here of Brian Thompson, the guy here on the left. Okay. They're in the golf course. Right there. So yeah. So we'll do one more, I think. Or actually two more. We know high prescription costs are a barrier to care for many people. This is why UnitedHealthcare is eliminating out-of-pocket costs for life-saving drugs like insulin. For eligible members and United Health Group employees, many people in our commercial and business worked hard to make this possible. I'm really proud of them. Okay, so while the move makes sense, when the layers are peeled away, it looks more and more like a PR stunt. The term eligible members, okay, is key in the PR headline. UnitedHealthcare reported that 51.2 million people were enrolled in its health plans globally as of June 30th. Of that total, only 8 million are in risk-based health plans in the U.S. That means just 8.6% of the UnitedHealthcare's health plan members could potentially even benefit from the company's move. Also, the new policy applies only to people in the company's fully insured group plans. That would eliminate anyone who bought their coverage on their own, including those who have coverage through the Affordable Care Act's marketplace plans. And it also excludes the 18.5 million people who were enrolled in fee-based self-insured group plans. Although UnitedHealthcare did say it would try to encourage its self-insured members to follow suit, there weren't many specifics on exactly how the company plans to do so. Beyond that, UnitedHealthcare had to acknowledge that just 688,000 people might potentially benefit. In other words, a maximum of 1.3% of the company's total membership. You deserve credit for the change, but also scrutiny for why it took so long to do so. And then this person said, happy to see it. We definitely can't be measuring A1Cs without first making sure members can afford their insulin. The right move, says Antonio Siachia. Amazing. Now let's focus on equity for everyone, not just for the insured. How can we come together and lower prices for all consumers? Said Corey Aman. Okay, he's an MBA. This is the right move, United Healthcare Group. However, it should be inclusive of all of your plans, not for a select few. Game changer, makes me proud to intern here. Okay. Barry Hastings, I worked at UHC until I discovered there wasn't any flexibility in the work schedule. What I did learn was some amazing accomplishments that no one mentions that really defines the company's incredible mission to improve health outcomes. UHC needs to be recognized for all the good they are doing. So, someone who worked for them and had a happy, positive feedback. And so forth. So, yeah. So, well, we're not going to read all the comments. This is incredible and such a game changer. So, not all of them were negative, right? Because it's not everyone that they're not denying everyone. They're denying 1/3 of the claim. But again, you just saw right there in those posts, he's not making nothing. He didn't even say hello. This is Andrew Whitty, the CEO of United Health Group. So the CEO of United Healthcare would have been Brian Thompson. The CEO of United Health Group is Andrew Whitty, and here he's being interviewed by CNBC. And Eugene Kavanaugh said, "Did they play tennis after or go back to?" Oh God. Okay. Yeah. So. Yeah, and I mentioned this, that even in their own network, their own social media network, people just were not happy with the services that this company, with that CEO. They're just not happy with the services that they're providing, and he had nothing to say. There's no evidence that he even exhibited any empathy for any of these people. So when Piers Morgan, when he goes on his show and he's asking people for, well, don't you have any empathy for Brian Thompson? So they're asking people who are critical of the health insurance industry whether they have any empathy for this guy, and why is Piers Morgan not asking for the executives at the United Healthcare or United Health Group whether they have any empathy for their customers, especially the ones who are getting their claims denied? Why is that? So it's easy for somebody like Piers Morgan, who lives in England, where he has socialized medicine. It's easy for him to ask for empathy. He doesn't have to worry about the healthcare problem at all. So this is the clip And we're going to go ahead and take a little listen uh, to Piers Morgan interviewing Brianna Joy Gray on empathy. Okay. Um, so he's clearly not listening, or he's choosing uh, not to listen at all, because she clearly says, if you listen to what she said, as an individual, we'll go back and rewind. But I believe she said, hey, as an individual, yes, I have empathy. But as his role, his institutional role as a CEO, no, I have more empathy for the people that this company damaged. I believe that's what she said. So let's go back here, which is the correct answer, you know, given everything that we've just looked at. So sorry with these ads. Okay, so her position is just very clear. If you just listen to her, if you listen to the words that she said, she's basically saying yes. If you just listen, you know, she's saying yes as an individual, yes, right. But as his role as a CEO, no.
it resonates so deeply with people that this has happened. You have to get to the root of why there is this deep well of tragedy, despair, and outrage in the United States of America. And that has to do with what Brian Thompson has chosen to do with his life, and what companies like UnitedHealthcare have chosen to do to the American people.
But just to be clear, before I go to Natalie to respond to that, do you feel any empathy for Brian Thompson and his family?
Listen carefully.
I have infinite empathy for any individual as a person.
She has infinite empathy for any individual as a person
in their personal capacity.
In their personal capacity. Okay? She's telling you, yes, as a person. She has empathy for Brian Thompson outside his role as a CEO of UnitedHealthcare.
As his role as the CEO of UnitedHealthcare, I'm afraid I'm with the overwhelming majority, bipartisan majority of the American people who say, I'm saving my empathy for people who are much more vulnerable.
But when you talk about his role as a CEO of UnitedHealthcare, she's more empathetic to the customers of that company. Okay, the people who've been damaged, the cases that we just looked at. She's saving her empathy for those people, not for this guy. And she has every right to feel that way. There's nothing wrong with feeling that way.
Much more vulnerable and have caused a lot less harm.
So to be clear, you don't have any empathy for him after he was executed?
I personally don't.
Right. Okay. Well, at least you're honest. Let me go to Natalie Winters. I mean, I find this staggering. You've got to remember, the left is supposed to be the party that cares so much. All of them have their Be Kind hashtags. They're the caring ones, the kind ones. And they can't even bring it in their hearts to say they find a shred of empathy for a man who's just been executed.
So here's Piers Morgan talking like a liberal Democrat. This is what the Democratic Party, this nonsense, the establishment of the Democratic Party puts out there. Oh my God, how dare you?
Executed, who's the father of children,
he's a
the husband of a loving wife, and so on.
He's a father. Clown. He's the father. He's married to his first of all, he was separated. He was separated from them. It's not like they were living with him, number one. Number two, the man had a drunk driving charge. It's not a saint. The man was accused of insider trading. Yeah, and not mention the fact that he's a CEO of one of the most, if not the most powerful health insurance company in the country.
I find that just staggering, that you can't, on a human level, have empathy for the murder of someone, but also make your point about the system in which he was an executive. What's your response?
I mean, it's absolutely shocking. And look, what it gets to the core of is the continued dehumanization of people, because in the sort of culturally Marxist paradigm of oppressor versus oppressed, you're allowed to do whatever you want to someone who has allegedly, or in this case, I'm not a supporter of the United States healthcare system or apparatus. Believe me, there's so many problems that need to be fixed and adjusted there. But condoning, which is in effect what these two panelists are doing, the assassination of him by a roundabout way by saying, well,
whoever this Barbie doll is, she didn't condone anything. It's just a bunch of nonsense. She did not condone a single thing. She didn't say, oh yeah, that I condone this violence. I condone all CEOs being assassinated. Ridiculous.
Well, the healthcare system, you just told me that you had absolutely no empathy and that you think what people are doing by gunning down healthcare executives because of bad decisions.
And by the way, I do not condone vigilante violence in either instance. So don't misrepresent my view. If you can make your case without telling a lie, miss, then you should do it. I have empathy for the 68 million Americans and their families who are killed every single year by the policy of the United Healthcare system with its
Don't talk over each other, we can't hear you. Okay, look, listen, Brianna, I'll let you speak, Brianna.
Okay, so anyway, in this interview, just so you know, it was just the right-wingers on this panel, just talking this nonsense Marxism. I just showed you the guy's LinkedIn account. Those people who responded to him were not Marxists. Okay? They're professionals. Okay? There's nothing Marxist about anything that they wrote. They themselves told him a year and 2 years ago of what his company was doing to their loved ones. And did he respond? No. Did he show empathy to them? No. Did he show even common courtesy? No. Did he show even at least, if we live in a capitalist society, we expect our companies to have pretty good customer service. Decent. Okay? Did he even show customer service at the very least? Absolutely not. He didn't even respond. He didn't even say hello. How was your day? Okay. And these people, these lunatics, they want us to feel empathy for that guy? Okay. Oh boy. But that's the problem with these people who get on TV, these so-called activists. They want to turn everything political. They want to these are just trying to chalk political points. Trump is coming into office, so they want to just score political points right before he assumes office. Anything that they can do to blame the left, or they can't blame the left in this case. This kid came from a conservative family, a Republican family. This kid represents the system that these people support. So he was fed up and decided to take up arms. Okay, and the right wing in this country supports the right to bear arms, and we're trying to protect ourselves from the government. Well, these companies use their relationship with the government to protect their own interests. This guy, bore arms. He did what he did, and we don't know all of the facts yet, but it looks like it was a political hit, and this happened. But don't ask us to feel empathy for the CEO. As the CEO of that company, yeah, we'll feel bad for the wife and the kids, his children, but there are others in this country who have a raw deal. So I'm not sure why these people are up in arms. Yes, it was tragic, but look what I should like. Again, I keep going back to that guy's company put that 84-year-old woman, her health at risk. Okay, yet she was off their plan for about a month. But why did they stress that family out? Okay, in the other cases that we looked at, them denying those people's claims. So isn't that a form of violence? Where was the empathy for them? Please like the live stream, subscribe to our channel, and this has been a PDR Live. Thank you so much for joining. Have a good night.